Understanding lumbar facet joint dysfunction, anatomy and pathophysiology. Lumbar facet joint dysfunction refers to pain and limited movement stemming from the facet joints in the lower back. Facet joints, also known as zygapophyseal or Z joints, are synovial joints located between the vertebrae. These joints allow the spine to bend and twist while limiting excessive movement that could damage the spinal cord or nerves. Each lumbar facet joint receives dual innervation from medial branches arising from posterior primary rami of spinal nerves. Facet joint dysfunction arises when these joints degenerate due to aging, injury, or repetitive movements. This degeneration leads to cartilage wear, inflammation, and pain in the affected area. Importantly, facet joint degeneration can also affect the intervertebral disc and vice versa, creating a complex interplay of issues. Several risk factors contribute to facet joint dysfunction. These include age, as natural degeneration occurs over time. Obesity places increased load on the joints. Previous spine injuries can also lead to dysfunction. Poor posture and activities involving repetitive bending or twisting also increase the risk of facet joint problems. Common symptoms of facet joint dysfunction include a dull ache in the low back, often worsening with extension and rotation. Patients may experience limited range of motion and stiffness in the affected area. Tenderness over the affected joint is common, and pain may be more pronounced in the morning or after prolonged sitting. It's crucial to differentiate facet joint pain from other conditions like sciatica, hip osteoarthritis, and spinal stenosis, as treatments vary significantly. To understand facet joint disorders, we first need to identify the facet joints in the lumbar spine. Facet joint disorders can be classified into four major categories. Degenerative disorders are the most common causes of facet joint dysfunction. Osteoarthritis involves cartilage wear in the facet joints, leading to bone-on-bone contact and pain with movement. Hypertrophied superior articular process is characterized by enlargement of the articular process, which can cause spinal canal narrowing and nerve compression. Facet joint cysts are fluid-filled sacs that form within or adjacent to facet joints, potentially compressing nearby nerve roots. This MRI image shows a facet joint cyst compressing neural structures in the spinal canal. Beyond degenerative conditions, facet joint dysfunction can also result from infectious, systemic, metabolic, or traumatic disorders. Traumatic injuries can lead to facet joint dislocations or fractures, particularly in high-energy impacts. Diagnosing lumbar facet joint pain presents several challenges for clinicians. Standard imaging like CT scans and MRIs may show facet joint abnormalities, but these findings often don't correlate with the patient's symptoms. Given these diagnostic challenges, specialized diagnostic tools are used to confirm facet joint pain. Medial branch blocks involve injecting local anesthetic near the medial branch nerves that supply the facet joints. Relief of pain confirms the facet joint as the pain source. Intra-articular injections deliver medication directly into the facet joint. While technically more challenging, they can provide both diagnostic and therapeutic benefits. SPECT-CT scans combine functional and anatomical imaging to identify areas of increased bone metabolism, helping to predict which patients might respond to interventions. Treatment for facet joint disorders ranges from conservative approaches to more invasive interventions. When conservative treatments fail, interventional procedures may be considered. Radiofrequency ablation is often considered the gold standard for managing facet joint pain. Radiofrequency ablation uses heat to disrupt pain signals from the medial branch nerves that supply the facet joints, providing longer-lasting relief than injections. Emerging therapies include endoscopic denervation and multi-fetus stimulation, though more research is needed to confirm their effectiveness.